Well, could well be, because then, for example, with fatty degenerative necrotic jawbone infections, also called cavitations, they sometimes happen when the teeth are extracted and it doesn't heal properly, and not healing properly could actually, as you just mentioned, be that they are not sufficiently supplemented with the proper nutrients. Absolutely.
Right, right. What role does emotion have? You touched on this just a little bit earlier.
Mm-hmm.
And what kind of emotions, and how can people encourage that type of emotion in an environment which just steams of conflict?
Okay, I had a few patients who had to come for surgery a couple of times for cavitation surgery. We did 2-3 surgeries in the same place, and it never really healed. Once they addressed their emotional issues in that, from that area, so let's say you have a large intestine, a molar on the lower, one of the big teeth, so that is connected to the large intestine.
Yes.
And one of the emotions for the large intestine is letting go. So looking into that, what is going on in your life that you don't let go, that's a big part. So they then looked into their emotional state and resolved things, and we did another surgery and it healed. Now you can say, well, it could have been something different, but I mean, we did many things differently from surgery 1 to 2 to 3, and only the fourth, when they then actually addressed the surgery beforehand by looking into their emotional state, then it actually made an impact. And so nowadays, I really ask them, before we do surgery from these areas, is there anything? I have a tooth chart where they can see positive and negative emotions, and I don't want to know what's going on. It's just about them looking at it, and then sometimes something crops up, and sometimes something comes up a bit later, and sometimes nothing comes. So, but it's very, very important emotions, because in the end, what are we having? What are we looking at disease when we look from a bit of a further perspective? It's our body telling us something. Look at this. And so we probably have been angry for a long time or depressed for a long time. And then you don't resolve that. And so the body has to take more severe measures to show you in a certain area to look at that. I mean, we're getting here into a totally different medicine, and I think it's important to be open for these kind of thoughts.
Yes. There must be a booklet that the SEMA experts are sharing, because I think it's 3 or 4 consecutive SEMAs we've had experts say the same thing, how basically it all starts with emotion. Like you've got to be in the right frame of mind
Absolutely.
before the healing can really start. And you've seen solid evidence of this post-operation. It's absolutely, I think you guys are trying to tell us something.
No, it's really cool. And you had Renzo Celani on your show the other day, and I use his mirrors with my tooth chart,
Yes.
where I have the emotions on and the meridians on, and kind of transfer that to the patient. So they sit on their on these plates, and then I use the mirrors on those teeth, and it's amazing how much better people now heal. I had another client, she had always problems, was falling into a deep hole after surgery for a week. She's off, she can't do anything, pain. And we treated her with the mirrors, and she had nothing like that at all. And just last week, I had another patient, and she was really, really terrified of the whole procedure. And she was one of those patients who got informed about almost everything the step we take, which was great. So she knew what's coming, which frightened her even more, obviously. But then she really was expecting pain. She was expecting swelling, and nothing. nothing happened. She's really, really happy that she got rid of that tooth and didn't have to deal with all the supposed consequences. So yeah, I'm absolutely sure that what Renzo Celani developed with his mirrors with the Light-Kinesiology is absolutely amazing. And I use it in my health consultations as a health consultant. We run through a program there where we get rid of so much stuff in one session, in probably about 1.5, 2 hours. It's really great. And in the end, that should be done before you do any intervention like surgery or amalgam removal, because then the body is really capable of dealing with that in a far better way.
It's amazing. It's absolutely amazing.
Yeah.
And it's good to hear someone who's actually using his system, because I mean, he was, yeah. So I'm hearing it from both angles. It's,
I mean, I did the course in February and then started on myself, because I always do the things on myself first before I give it to the patient. I want to know what's going on. Yeah, I walk my talk, so to say. And I've done it. I've been there. I had cavitation surgeries and I had my mercuries out and the detox. So I really know what I'm talking about. And I think this is very important, because then the client also feels that there's authenticity, that you really can feel with them. You know what you're talking. You're not just reading it from a script.
Yes, yes. Jeremy's asked a question. I think we've answered this one before, just a little bit earlier. Can cavitations heal without surgery if other factors such as diet or emotions are dealt with? The answer was a yes.
Well, as of now, I haven't seen a cavitation healed without surgery. That doesn't mean it hasn't happened. I'm pretty sure that with the mirrors, we're on something very special there. I know from Philip Mollica in the States, he uses ozone treatment. So he brings ozone in the cavitation, and he says that he can heal the cavitations with that. Well, I've done that for a while, and I think it holds the infection, the inflammation there. But I don't think that if you don't remove the cause, you will get rid of the problem. And Dr. Hans Lechner from Germany, I mean, he is researching on that topic for decades. And he also says at the moment is the surgery.